Urgent assistance.
In modern Britain,
There's been a big accident.
the most dramatic 999 calls
The car is now on fire.
often require not one, but two emergency responders.
I'm a police officer, she's a paramedic.
In Kent, one of Britain's biggest counties,
I'm just thinking if we just cover it all.
a groundbreaking joint response unit has been formed,
Ready, set, lift.
where both police and paramedic combine in one specialist vehicle
You've been arrested for assault.
to answer some of the most extreme 999 calls.
Right, stand clear. Everyone clear? Shocked.
We already outdone ourselves on that one.
Face the wall.
Mate, I can't believe we got him.
Coming up, attacked in his own home,
This one was one was holding the blade and pushing him back.
a high-speed crash ends in a manhunt,
We've now got units plotted up all around.
and a woodland walk ends in agony.
1, 2, 3.
Covering nearly 1,500 square miles of Kent, the Joint Response Unit is on standby for dual emergencies requiring both urgent police and medical care.
Can police, where's the emergency?
Road traffic accidents are the third most common emergency response for the unit, as they require both the skills of a highly trained paramedic and a police officer to make the scene safe.
Okay, we have got an ambulance en route. It is an ambulance and a police officer, okay? It's a vehicle on its roof. It does say that it's gone through a wall and a fence of a house of her.
It's 11 p.m. Paramedic Nathan from the South East Coast Ambulance Service and Special Sergeant John from Kent Police are on their way to a Joint Response Unit emergency.
We've got a rollover RTC. The male's got himself out of the vehicle, but he's clearly intoxicated. The passerby has tried to keep him on scene, talking to him, but he's now trying to leave the scene.
So you've not only got kind of like the concern for welfare for him, okay, he's also potentially committed offences as well.
The JRU, or Joint Response Unit, can get to the scene faster than an ordinary ambulance, delivering the specialist skills needed.
Right now with someone. He's bleeding. Yeah, if he's gone across those fields, it'll come out the back of the road.
The man has left the scene of the crash, and he could be seriously injured, so he needs to be found fast.
We consider drone and dead fast, please.
NPAS, the police helicopters, are just one of the resources the cops have called on to help in the hunt, if he's not found on foot first.
There's quite a lot of resources on this. The most important thing is to get the containment on, so dogs have a good chance of tracking or whatever. Do you want to show JRO4, State 6?
As the rollover is in a residential area, there are many places to hide.
We have one patrol, stay where you are with fire. Have JRU head to the other side of the road. Suspect has not been found and he's still outstanding.
Right down here.
So keep going straight.
A sergeant is in charge of coordinating the search, and John and Nathan are assigned to a strip of land to the north of the upturned vehicle to help contain the missing driver.
Control JRO4. We're plotted up by the railway crossing. We are almost directly opposite where the car's rolled. The drivers ran off. We've now got units plotted up all around. It's a really big area to search. It's obviously pitch black, and we're waiting for a dog unit to come down and to see if NPAS is going to fly for us.
20 minutes after the call-out,
All right, the scene outside of the road. Is there trees or something?
police believe they've contained the male within a half-mile radius, and the net is closing in.
So he's in the
Right
orchard.
ahead.
With most crimes occurring between the hours of 10 p.m. and 6 a.m., the Joint Response Unit can guarantee a busy night shift.
Can you get Romeo 01 to control, please? We've got a stabbing. Let's shoot this.
Knife crime is on the increase, And in 2021, ambulance crews in Kent treated over 190 stabbing victims. But it can be dangerous answering a call-out to a violent crime without the protection of the police.
Good lad.
Tonight, on duty with paramedic Chelsea is Special Constable Clive.
We've got reports of a stabbing. We believe it's a stab wound to the arm and potential slash to the hand.
A stab wound to the arm can be very serious because you've got your brachial artery in there. If it's got that, then you get some very, very serious blood loss.
So they've lost more than 2 mugfuls.
More than 2 mugfuls for us goes down as catastrophic hemorrhage.
A stabbing incident means a fast response is critical because bleeding from an artery or main vein can prove fatal in minutes.
Does it say about whether it's spurting or not?
Blood spurting or spraying from wounds. Obviously, priority number 1 is going to be making sure that the scene's safe for Chelsea to be able to work and make sure that the victim's safer as well.
If we didn't have the JRU, if I was going to this as a normal ambulance, I would not be entering the scene until police are there. So that can sometimes delay getting care to that patient. Perfect JRU job.
And especially in this type of vehicle, we're able to travel at a normal response speed.
Yeah, these cars go a lot quicker than ambulances. Love that hat at the ready.
Another police patrol has responded to the high-priority call-out.
Hi, how's it going?
Hi.
But Chelsea is the only paramedic on scene.
What happened, bud?
I've got out of the shower, come downstairs, and the door's knocked in and there's a group of boys. They started asking me for drugs.
Yeah.
I said I didn't have any, and started pushing the door. I was holding on to the blade. I think they punched me in the face and they said he's got a gun.
Listen, it's gone through some fatty tissue.
Crucially, the brachial artery hasn't been severed, but with severe lacerations to his arm and hand, it's important the victim's traumatic injuries are treated quickly to prevent further bleeding or infection, and his status is constantly monitored.
How about your pain out of 10 at the moment? 10 being worst pain ever, arms and legs ripped off, 0 being nothing. Give me a number.
Give us a number. Number 9 if it's a different 8 or 9, no worries.
Chelsea manages the victim's pain so he doesn't go into shock.
Give me a sharp scratch, buddy, stay nice and still.
She fits a cannula to administer an intravenous dose of paracetamol, while Clive joins the rest of the police to hunt for signs of the intruders.
Someone's touched all of that.
Yeah.
There's some bits missing from here. They've touched all of this.
Did they actually come in then?
I think, yeah, Dave was definitely in here.
What, and there's things missing?
Yeah.
Can we get CSI to come out?
A search of the house reveals more evidence.
Is this someone's hat?
Is it River Island?
No, it's an Amani one.
I don't think it is. I think it must be one of theirs.
It was right outside the front door when I got here.
There's potential for forensics. There's been some clothing that's been left behind by the attackers. And there could always be blood from the attackers if any of them got injured by their own weapons as well.
You all right? In a bit of shock, eh?
Yeah.
Applying a temporary gauze dressing to his deep wounds is just the first step. Chelsea needs to establish if the victim's been knifed anywhere else.
Do we have a weapon at all? No.
It's been described in a Rambo 9.
And with the gang still at large, police comb the area as it's still a dangerous crime scene.
Where do we think it's going across this field? They directly outside of the road. I think there's trees or something.
3 patrol units, including the joint response team, are closing in on a suspected drink driver who's been missing for half an hour. Special Sergeant John leads a search across the fields.
Who's in the orchard?
If he's caught, it's critical Nathan, the only paramedic, examines the driver.
It's just a case of when we find him, what injuries he's got, and making sure medically he's okay and that he's fit to then for the police to deal with kind of the criminal side of things that's happened.
110, well detained. Yeah, can we have another unit down here?
Fortunately, they don't have to wait long.
I'll place him under arrest at this time.
We'll go check him over.
One of the patrols has detained the suspect, but there's a crucial bit of evidence Nathan needs to look at to help assess the full extent of his injuries.
If we stop off at the crash, just so I can see the car before we go to him. Looking at the car, you can be able to tell if he was wearing a seatbelt, if airbags have been deployed, whether it's likely he's hit his head on the windscreen. It just gives you a better understanding of what, if he has got any injuries, how he's sustained those injuries. So he has actually rolled it properly.
Incredibly, no one else was involved in the accident. But whoever was driving has taken the keys.
So his seatbelt's locked out, so it means he was wearing a seatbelt at least. Front airbags haven't gone off, so we'll go have a look, see how he's doing, and then go from there, really.
Give me a quick search. Go.
Caught half a mile away, the suspect denies driving the car or having anything to do with the crash.
Keys?
There's given me 3 after the crash.
Okay, but you've got the keys to the vehicle, have you?
Yeah, I'll do.
Sure, no problems.
Do you want to be medically checked over? Has you been in a crash?
I haven't been in no crash, sir.
Have you not?
No.
No?
No.
Are you happy if my colleague at least checks you over to make sure that there's nothing that we need to be concerned about? Let's let him check you over.
If you think I've been involved in a crash, then please do. But I haven't been involved in a crash at all.
Even though the suspect appears visibly drunk, alcohol and adrenaline can mask any injuries, so it's important Nathan examines him thoroughly, while John reports in to control.
You'll show JRO4, state 6.
I've been involved in no crash, so...
If you were involved in a crash, would you have been wearing your seatbelt?
I would have been wearing my seatbelt, yes.
Good. So if I roll one of your sleeves up and do your blood pressure?
Yeah, that's fine, sir.
Might not roll up. Shall we take... I'll tell you what.
I'm not going to run anywhere. I'm not going to run anywhere.
Just hold on to it, mate.
I'm not going to run anywhere.
That's right.
Thank you, boys.
While Nathan takes his blood pressure, he's suspicious that drink may not be the only factor involved.
You had any drugs today?
No drugs, sir.
No? Your pupils are very big.
They're always big, sir.
Always that big?
Always big.
Always really slow at reacting to light as well?
Yes.
Yeah?
Yes.
No worries.
Well, sorry, sir. I may lie. Once, it's only once, I did do a little tiny bit of gear, and that's it.
Was it cocaine by any chance?
Cocaine, yes.
Yeah, have you had any cocaine today?
Only when I left work.
Because your heart's going rather quick.
It's not.
It is?
It's not.
So it's going 140 beats a minute. Can I do an ECG of you to look at your heart?
Yes. Everything's fine.
Oh, it's still going a bit quick.
Confident they've got their suspect, police will gather any evidence before he'll be taken down to the station and charged.
The custody sergeant's just doing some photographs of the car.
I've got some if you want them.
Oh, have you got some?
Yeah.
Oh, can we have a look?
Yeah.
We just want to know if the airbags have gone off.
So?
No.
So, what was it? Was you going to say something then?
No.
No. I don't know how you know the airbags haven't gone off.
I don't know how you know that.
The suspect is still adamant he wasn't involved in the accident.
If there is a major crash, it'll be more blood than that, sir.
No, sir.
No, sir. Yes, sir.
3 bags full, sir.
Yes, sir. 3 bags full, sir.
Full of what, though?
So,
He'll be taken to the station and questioned. But having a JRU paramedic check him over has saved a costly ambulance call-out.
Have you got any other concerns for him other than...
Just a heart rate, really.
If custody are happy to accept him the way he is, does he need to go to hospital for the heart, or...?
If they're happy to accept him with his heart rate that fast, and potentially cocaine and RTC, then that's fine.
Right.
He's got no head injury or anything like that. Pupils are just sluggish.
Okay, and we think that's potentially because of the cocaine.
Drugs, yeah.
Okay, fine.
Drugs and alcohol, definitely.
No problems?
A custody nurse is always on hand to keep a check on symptoms and provide further care for anyone being detained.
When you're moving around, have you got any pains anywhere?
no, apart from these that think I'm a bad person.
Definitely needs to be monitored. We're giving that advice across to the police, which have passed the custody, so up to them whether they accept him in custody or we'll send him to hospital. Right, let me move this all out of the way. It was quite a good job from the joint response side. We've been able to stop an ambulance having to come down.
If custody accepts him, he'll be left to sober up before facing criminal charges.
I think it's a successful completion stats. We've got what we think is the drink driver and the drug driver as well, by the looks of it, after Nathan's assessment. No one else is injured. Car's getting recovered now as well, so he's off to custody. Since we're high five. Right, next job.
While John and Nathan prepare for their next emergency,
Is this definitely the only stab wound, bud?
a joint response team are in Sheerness, where a victim's been repeatedly knifed in his home.
What, are those things missing?
Yeah.
Can we get CSI to come out?
Special Constable Clive helps gather evidence and make sure the scene is secure for paramedic Chelsea to do her job.
You go this way as well. Just make sure that you've not been got anywhere else that you've not noticed.
Wonderful, I can't see anything.
You have a little stand up for us a moment, mate.
It's because of adrenaline, do you know what I mean? It's going to mask a lot of injuries. It's unfortunate for the gentleman, but I think it's good that we had the resources in the area that we're able to get on scene so quickly.
So, did you give me a number out of 10 for your pain?
9.
A 9?
8 or 9.
Okay.
It's going up and down.
It could have been a lot worse than what it was. He managed to fend them off pretty well, and he has got some pretty nasty slash wounds in the process, but luckily it hasn't kind of cut through any major blood vessels, and he hasn't got any major stab wounds to kind of any major organs. Definitely going to need some stitches and stuff.
Once Chelsea has finished her assessment, the police pick apart the sequence of events.
The door knocked, so I went to open it and they was asking for packet.
Went to open, was asking for packet, yeah.
So I said that they've got the wrong address. As I shut the door, forced the way back through. I've had hold of one of the blades and there's another 2 coming through.
Yeah.
I've fallen back, which is when they punched me in the face.
Yeah.
And they've asked me where everything is, and basically all I've got is a wallet, a pouch of tobacco, and half a spliff in the ashtray, which they've taken as well. And they weren't very happy, I don't think, but that's all there was.
Okay.
They mentioned looking for a package which would be slang for drugs, which obviously wasn't apparently at the property.
I don't know if I lost consciousness, but I saw them leaving with my scooter.
Police think the gang may have mistaken the victim as a drug dealer. And with drug use increasing by 38% in Kent between 2019 and 2020, the force's county line and gang team have been busy, making over 300 drug-related arrests.
It's quite common for gangs to target their competitors, as it were, but unfortunately innocent sort of members of the public get caught up in that just through rumours and incorrect information being spread.
While police continue their search of the neighbourhood, forensics will do a sweep of the house and the victim will be off to hospital for stitches.
Don't touch the hat.
Don't touch the hat. Don't touch the hat.
And it's only the start of the night shift for this duo.
When we have a busy night, boom, 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 and all of a sudden your shift's done and you're just sitting there, and I'll be talking to my wife, like either that night, she'll go, oh, tell me about it, and you forget about half the jobs because
you've done so much.
Like it does get a bit mad.
Away from the towns, Kent, the Garden of England, is known for its beautiful countryside and woodlands. But the idyllic landscape can throw up its own challenges for the emergency services.
So going to a 53-year-old who has been walking his dog and has fallen over. He's in the middle of the woodland. His knee's clipped and he can't straighten his leg, so he can't get off the road.
In a quicker, more adaptable vehicle than an ambulance, Joint Response Team paramedic Hannah and Special Sergeant Jack respond to the call.
We don't really know where he is, so obviously if he's quite deep into woodland, then extricating him could be difficult.
By the looks of it, it's a fair way in.
It's a fair way in.
It might be a bit of a challenge finding him because it's quite dense woodland.
Darland Banks is a large nature reserve in North Kent.
You see this gate here?
Oh, yeah.
There's a little pathway next to it, and it's all the way in there.
The team prepare to hike into the 80-acre woods, carrying all the medical equipment they can manage.
How strong are you feeling?
Yeah, go on.
You can take some Internox, I suppose.
Got to try and find him now.
Somewhere in the middle of the dense woodland is the injured man, and Jack uses a GPS app to help locate him.
This gives you direction. You need to walk in. So we need to walk that way.
Okay. Stuff like this makes me think I should probably go back to the gym.
So he's 208 metres away from us at the moment.
Is that far?
There he is. You can see him.
Can you see him? Hello. My name's Hannah. I'm a paramedic. What's your name?
Simon.
Simon. What's happened today, Simon?
Right, basically I was walking the dog, lost my footing,
Yeah.
took a stumble and my legs went like an octopus spaghetti.
So where's your pain at the moment?
Left leg is totally worse, right leg is basically the knees. I've tried to get up but my legs just go into spasm and cramp up and seize.
So your knees where it should be, yep, your knees there. I'm moving your knees side to side, okay? We've got 4 ligaments that hold our knees in place. Ones go side to side, others go like that. So you might have sprained or strained your ligaments when you've fallen.
But there's no painless way to find out.
Are you okay for me to take the weight of your leg and bring it up? Lovely. And then flex it. Okay, that's painful, we'll stop. Okay. Injury-wise, I think we're looking at ligament sprain and strains, probably to both the knees, which is why we're in pain. So I'm going to get a crew and then we will make a plan from there on how to get you out. Is that all right? Yeah. Yes, he came JR01. This gent doesn't seem to have any bony injuries. I think if anything, it's ligament sprain and strains he's done to his knees. So I'm hoping we're going to be able to wait there. But obviously, I'm going to need a crew if that's okay.
Yeah, they'll be with you off break in just under a minute.
So with support, do you think you'll be able to wait there?
I'll give it a go if there's
Okay.
more people
Yeah,
here. Earlier on,
okay.
there wasn't excruciating when it happened. I never felt anything like it.
Special Sergeant Jack can relate to Simon's pain.
I dislocated my knee and he's right in what he says, it's excruciating.
But there's a far bigger problem.
We're getting him off the floor and see if we can get him out. Hopefully he'll be able to walk with assistance. Otherwise it'll be having to try and carry him out.
In Darland Banks Nature Reserve in North Kent, a man's been lying for 3 hours deep in the woodlands after stumbling and falling.
And then flex it. Okay, that's painful, we'll stop. Okay.
Unable to move him, JRU paramedic Hannah called for backup, and Special Sergeant Jack leads the ambulance crew through the woods to their location.
Okay, they come. Oh, hi. So this is Simon. So injury-wise, there's no obvious deformity to either knees. So I'm hoping with support either side, we're going to be able to wait there.
Before the challenge of getting Simon up on the stretcher, Hannah must manage his pain.
Internoxal, as it's better known, gas and air, is an inhaled pain relief. It helps relax the muscles as well, so it's quite good. Deep breaths in and out your mouth like you're sucking through them. I'm hoping once we're up, especially with that right leg that doesn't seem as badly injured, we're hoping we're going to be able to weight bear through the right leg to kind of mobilise us out.
Hannah believes Simon sprained his ligaments in both knees, so he'll need a lot of extra support to get off the ground.
We're going to assist you to stand, but I need you to push with your legs when we get to a certain height. Yeah, 1, 2, 3.
No.
No? What's hurting? Is it both or just one?
Both. Okay.
Relax. I didn't expect trying to weight bear to be quite that painful, but we're going to try again, get him on the carry chair.
Right, we're going to go for it.
After 5 more minutes of gas and air, Simon is ready to try again.
Push the chair in for me. 1, 2, 3, push the chair.
There we go.
Nuts!
You're nuts. Do you want to position it? Push yourself.
Always better.
Yeah? Obviously, we've got our stretcher there, but we'll bring the stretcher next to you and we need you to weight your belt on your good leg and literally swivel, turn and sit your bum down on our stretcher, all right?
Do it.
All right, I like it, I like it.
Ready? 1, 2,
2, 3.
Yeah! You fuck! Yeah! No, don't go back on the floor, God.
Oh, jeez, up there.
It's crank.
Get that in.
I can't move my right leg.
I know.
It's all right, it's coming up, mate. I can't.
With the help of 5 people, Simon's finally up on the bed.
There we are.
Well done.
There we go.
You tried, that's the main thing, all right?
We've just got him onto the stretcher from the carry chair and now we just push him back to the ambulance.
But it's a long push back to the main road.
Ready? Which way are we going?
This is going to get a bit bumpy because there's tree roots everywhere.
It's going to get worse.
Another one.
I'm never coming up here again.
I bet you'll be up here next week once your knee's sorted.
Finally, after 10 minutes, they make it to the ambulance.
You're in.
Sorry I was in such a
Don't be sorry,
place.
it's not your fault. So Simon will be off to hospital, probably have some x-rays to rule out any possible fracture, and then, yeah, go from there.
Kent Police, where's your emergency?
Romeo 01, go ahead.
OK, just take a deep breath. Where's the victim been wounded?
At police and ambulance control rooms, all 999 calls are categorised. A C3 ambulance call is an urgent problem like a diabetic issue that needs assessment.
Are you on your own?
A C2 is a serious condition like a stroke that needs rapid treatment.
I'm arranging deployment for you now. They won't be too long at all, OK?
But a C1 or Category 1 call needs an immediate response to a life-threatening condition like a cardiac or respiratory arrest.
We've got a C1 for unconscious abnormal breathing in Sittingbourne. If there's anyone close enough to assist, please contact control.
01, do you need help on that C1?
Yes, please. Thank you so much. Coming through now, Ivor.
The JRU teams may be set up for dual emergency call-outs, but they'll also respond to a serious medical emergency if they're closest to the scene.
Where's the location? Actually in the street. Yeah.
And tonight, it's paramedic Chelsea and Special Sergeant Holly jumping on the Category 1 call, even though only a medic is needed.
A C1 at the end of the day could be life or death. It seems like there's multiple different calls for potentially the same person. This has come through as a cardiac arrest. Before that, we were going to a C2 job in the exact same place. However, before we got either of those calls, we were looking at going to a concern for welfare, also for somebody with the same name. So I'm going to have to guess and say it is the same person.
Receiving a Category 3 call and then a C2 and now a Category 1 call for the same person means one thing. Their patient is rapidly deteriorating.
Joint Response Unit will always prioritise C1 if the point is that there's a paramedic that could get there fast. Sometimes we have been first on scene to C1 calls and the police have had to do CPR whilst we wait for backup.
There, just there. Oh, Martin! Hello, bud. Hello, my name's Chelsea, I'm a paramedic.
Immediately, Chelsea can see the man is breathing, unfortunately not in cardiac arrest.
What's going on?
But it's still unclear why he collapsed.
Went up the road to have a little walk.
Yeah?
Come back and it just went bang.
You just went bang?
Straight on the floor.
Do you remember that? Okay.
While Chelsea checks Martin's vital stats like blood pressure, oxygen levels and heart rate, Special Sergeant Holly speaks to witnesses.
Does anyone know him or? Oh, okay. Oh, okay.
Yeah, I live in the flat over there. So I live in here, but I don't know him.
Don't know him.
He got lots of medical conditions.
Oh, how do you know that?
Caretaker.
Yeah.
Pardon?
Second time.
Second time this week? And when you've had these blackouts before, do you know what they've been caused by?
Parkinson.
Your Parkinson's.
Dizziness and falls can be common for people with Parkinson's. due to lack of balance because of muscle weakness, problems with blood pressure or posture.
Luckily for us, he was conscious and breathing, which is obviously the best case scenario. It's just a medical condition that's made him collapse. No other aggravating factors and no danger to us or the paramedics.
01, a patient is conscious and talking, but can I get a crew grade 2, please? Martin?
Yeah, I think it's Florida's baby.
Martin needs emergency care in hospital.
Martin, I've got some more ambulance people here, all right? Do you normally have pain in that left hip? No. And how bad is that pain out of 10? 0 being nothing. And 8? Okay.
Martin?
Yeah?
I think we'd like to take you up to hospital and try and get this hip looked into, and obviously you've had a passing out episode. I'm just going to pop this back over you, just try and keep you a little bit warm.
No one knows how long Martin's been laying on the cold concrete.
I bet you're freezing. I've got the heating on in the ambulance, so it should be nice and toasty by the time we're...
He's lovely, isn't he? He's very thoughtful like that.
He's very thoughtful. Oh, sorry, that's my foot. That's my foot.
There we are.
Cool. Couple of bumps. Pop your head up for me. I'm just going to swap out. This isn't as comfy. Put your head back down. Is that okay? I'm going to jump out. Yeah, do you mind?
After 3 different 999 call-outs, Martin's safely off to hospital for a thorough examination.
All right.
And the crew head off to their next job.
01, sorry, I never updated you earlier. We really outdone ourselves on that one. 2 jobs for the price of 1.
It was 3 jobs, so I'm well impressed with you. 3 jobs in 1 hit. Outstanding work. You got a key for your up though?
Let's see what we can achieve.
Awesome. Thank you, my love. Take him out.
Kent, the gateway to Europe, has a network of over 5,000 miles of public roads and is home to 4 major motorways. But an accident on one of these key arteries often requires a combined police and paramedic response.
How far is it?
Okay, so we've like 10 minutes if that.
On their way to a road traffic emergency is Special Sergeant John and paramedic Nathan.
We're currently going to an RTC where someone has collided with a central reservation. So, police side, we're going to go there, see if we need any other resources. From an ambulance side, we'll go assess the patients. Oops, I had a crash there.
With the car on the busy M20 motorway, there's a huge risk of multiple casualties if it's hit the barrier and spun across lanes of traffic.
Coming up on the left here.
Yeah. Who's here?
Truck.
Great, I'll hide behind there.
Critically, the passengers are out of the car and seem unhurt.
Okay, right, we'll all get the other side of the barrier.
But with traffic flying by at speeds of up to 70 miles an hour and the car straddled dangerously at an angle across the hard shoulder, there's a risk of another high-speed collision. So the team work quickly.
What happened then?
Just control the wind, innit? Just blew her up. Luckily, we was on this lane.
With gusts of wind across the 3 lanes of the fast-moving motorway, John needs to get the car safely off the road before there's a much bigger accident. He calls for urgent backup, and police colleagues organise a traffic calming measure using traffic cops with Special Constable Tom and paramedic Lisa to help.
Going to put a rolling road in just to give the crews there a bit of protection and obviously members of the public a bit of protection.
A rolling road is a slow manoeuvre the police use to reduce traffic speed to a temporary stop. But it's not an easy procedure and is only used as a last resort.
Don't undertake the absolute.
And then you get people like that don't understand what a rolling road is.
What we'll do is I will weave between the lanes and bring the speed right down. So what I'll start to do now is bring it right down to a stop. So it's the only safe way to actually put a closure on a motorway, and hopefully everyone will get the message that they are not too far. JL01 then. We've got the rolling road on, so you should be safe for there.
Now the traffic's under control, it's safe for John to check if the car is entirely on the hard shoulder, and there's no danger of it rolling or causing any further accidents on the road.
Is it?
No, it's just onto the hard shoulder now, so should be able to let it out in a sec.
All safe, he can breathalyze the young driver.
Keep going, keep going, keep going, keep going, keep going. So that's 0, which is great. Okay, so lovely.
A negative for the driver, but a positive result for the team. Now the road is safe and a potential catastrophe has been averted.
What we'll do, we'll arrange recovery, okay, and then be on your way.
Compared to regular ambulance staff, paramedics are degree-level medics with more highly skilled training and expertise in critically ill and injured patients.
We are off to a grade 1 backup for a confirmed heart attack. There's an ambulance crew on scene. They've done an ECG. They've determined it's a confirmed heart attack. We've been requested to come along for paramedic support.
A patient is suffering a heart attack, and an ambulance crew needs the help of a paramedic like Nathan, trained to administer cardiology drugs and manage high-risk medical conditions. And time is of the essence.
7 minutes is the Category 1 response time, so we're just coming up to it now.
Category 1 calls need to be responded to in an average time of 7 minutes. And a JRU car can travel at the same high speed as a police pursuit vehicle.
7 to control, please.
Special Constable Clive reports in.
Yeah, CCAM's got a C1 confirmed cardiac arrest. We're just backing up a ambulance crew at the moment.
With the risk of his heart attack progressing, the patient needs to get to hospital urgently for life-saving treatment.
What's your name, sorry?
Billy.
Billy. Billy. Pain out of 10 at the moment.
It's painful.
Painful, that's fine.
Oh, you leaving it? Leave it.
Came on about 8 o'clock.
Yeah.
Crushing pain. It radiates down to his back and down his left arm.
I got home from work. I just didn't feel good.
Yeah.
Oh, you know, it always takes your breath away.
Just going to get a line in quickly.
With no time to lose, the first step is to fit a cannula, which Nathan will use to administer life-saving medication.
Keep the arm nice and straight for a sec, sorry, mate.
And every minute counts.
Did you say I was having a heart?
So it looks like you are, yeah. A heart attack can be life-threatening. It could lead to a cardiac arrest, which will obviously lead to death. Where's the tingling?
My toes.
So just try and slow that breathing down for us. With a blockage in your heart, time is critical. Just gonna pop this by your nose a second.
In Raynham, North Kent, paramedic Nathan from the Joint Response Unit is assisting an ambulance crew with Billy, who's having a heart attack. But the specialist cardiology hospital is 30 miles away.
So every 5 minutes, your blood pressure's gonna go off. You're gonna keep squeezing on your arm all the way to hospital, just every 5 minutes.
Oh, my God, that's gonna go.
Yeah.
Nathan has to keep Billy stable, reducing the risk of his heart attack leaving permanent damage, or worse, suddenly progressing to a cardiac arrest where his heart stops completely.
Has that pain eased a little bit again, or is it still there? That's fine. At the moment, we have given this gentleman aspirin, Irregular, anti-sickness, morphine, all help with pain relief and relieving the symptoms of a heart attack.
Authorized to administer a number of drugs to reduce his pain, Nathan gives him another dose of morphine, helping to reduce inflammation and stress on the heart.
Hi, it's Nathan on ambulance 467. We are about 10-15 minutes away. Obviously, if it is a blockage, that's stopping the blood supply properly getting to perfusing the heart. So the quicker we get there, the quicker they can remove the blockage and relieve it and get blood flow back to that section of the heart. So yeah, time is kind of the essence. How's that pain now? Is it eased off a bit? Sorry to wake you a bit. not nice. Not nice, no, sorry.
CCAMB, the South East Coast Ambulance Service, receive over 2,000 emergency calls a month for cardiac chest pains, and swift action can be the difference between life and death.
I'll give you another spray of GTN, all right? So if you open your mouth again for us, lift your tongue up. GTN just helps relax the muscle tissue in simple terms. So if there is a clot there, helps release all the vessels around it.
You've probably worked it out, Nathan, but we're stuck in traffic at the moment because the road works. Nothing I can do at the moment.
With 14 miles still to go, a traffic jam is the last thing Nathan and Billy need right now.
We don't get any warnings as to what roads are shut or some traffic down to one lane. If you're sat on blue lights trying to go through it, you're not getting anywhere, unfortunately. Hi, it's Nathan on 467 again. Just to let you know, we're still 10 minutes away. Unfortunately, the M20's down to one lane, so we're stuck in heavy traffic.
With a blockage to the heart, it's critical Billy reaches the operating theatre in the recommended 90 minutes or less, and statistics show that every 10-minute delay reduces the chance of survival.
Do you want any more of the spray? Yeah. Obviously, try and manage his pain as best as we can. The side effects of the pain relief is that it lowers blood pressure, it makes you quite tired, sleepy, your breathing starts to slow down a little bit. So it's just a fine balancing act between managing his pain and making him worse when his observations are getting worse anyway. I've got his blood pressure cycling every 5 minutes, and then we've also got the ECG. Every time there's a slight change on the ECG, it automatically prints out again for us. Just compare it, so the first ECG we have, and then the latest ECG, just to see if there's any increase or decrease in the elevation. These blood pressures started to trend down a little bit.
A very low blood pressure significantly reduces the amount of blood the heart can pump around the body. But Nathan is just focused on keeping Billy alive.
Road should open up now, so we should be a little bit quicker getting there now, all right?
I can hear you talking, it's just struggling to
reply. That's all right. How's that pain out of 10 at the moment? Yeah. 6 or 7, okay. So just pull into hospital now, all right?
The unit's quick response for an emergency paramedic and Nathan's cool head means Billy's arrived without any further complications.
I think we've just parked up. We'll wait for him to come around. So, be a bit cold as we go out, all right? Sorry for any bumps as well. I do apologise now.
Now he'll be in the hands of the specialist cardiology team, and it's the end of the shift for Nathan.
When I left him, he was still chatting away, still in pain, unfortunately. He was just going into the theatre. In an ideal world, he'll recover quickly and he'll be back out doing what he'd normally do, fit and healthy, as you can be following on from something like this. Bit of aftercare from the community teams, hospital teams and stuff like that will hopefully increase his chances of having a positive outcome.
I was holding on to the blade and it punched me in the face and he said, "He's got a gun."
One, two, three.
Did you say I was having a heart?
So it looks like you are, yeah.
Police! Urgent assistance!
In modern Britain,
There's been a big accident.
the most dramatic 999 calls
The car is now on fire.
often require not one, but two emergency responders.
I'm a police officer, she's paramedic.
In Kent, one of Britain's biggest counties,
I'm just thinking if we just cover it all.
A groundbreaking joint response unit has been formed.
Ready, set, lift.
Where both police and paramedic combine in one specialist vehicle.
You've been arrested for assault.
To answer some of the most extreme 999 calls.
Right, stand clear. Everyone clear? Shock.
We already outdone ourselves on that one.
Face the wall.
Mate, I can't believe we got him.
Coming up.
Get here now.
A car thief, armed and dangerous.
What have you got in your pocket? My pocket.
Got a Stanley blade on him.
A driver in distress.
What's happening? If you come with me, I'll show you.
And a high-speed collision puts lives at risk.
The driver of the BMW is very lucky to be walking away.
The Joint Response Unit of the South East Coast Ambulance and Kent Police were set up to help speed up response times to every kind of 999 call.
Kent Police, where's your emergency?
From violent assaults
Where's the victim been wounded?
to road traffic collisions.
I would get someone out as soon as I can.
Using state-of-the-art high-performance cars fully equipped for police officers and paramedics. And with a top speed of 125 miles per hour, the JRU get to certain call categories on average 20% faster than standard ambulances,
What if we could send police and ambulance for medical support, please?
which saves both time
Right, stand clear. Everyone clear?
and lives.
The male has been assaulted. He is conscious and breathing, but he has got quite a nasty head injury.
Paramedic Jordan and Special Sergeant Hannah are responding to an urgent call.
We're going to a member of the public who is currently got a head injury. He's currently being restrained by another member of the public for trying to get into a vehicle. So it seems that he was trying to potentially break in or steal a car.
Incidents like this are made for the Joint Response Unit.
So it's a perfect JRU job. With a head injury, perfect for a paramedic to check him over, make sure, obviously, if he needs any medical attention, and obviously for the police, in case there has been any offences in terms of burglary, theft from a vehicle, anything like that going on, or criminal damage.
Another police unit is already at the scene,
Hiya, guys.
but Jordan is the first paramedic to arrive.
He's a known heroin user.
Yeah.
He has got quite a lot previous for theft from motor vehicles. That's how he tends to fund his habit. From what we've been told, is he's been seen to be trying to break into a vehicle. He's then being chased by the person whose vehicle it is, and then they've restrained him. Seems like they've been a little bit vigorous in their level of restraint.
Are they still here?
No, they've gone in the vehicle that was attempted broke into. He hasn't moved from this position.
So was he talking to you when you first arrived? No. Was he like
No.
this?
The injured man could be unconscious due to his head injury, but drugs may also be involved.
So he's known to you guys being a heroin user?
Yes.
Yeah.
If he's unconscious because he's taken heroin, Jordan can help by giving him something to counter its effects.
His heart rate's a bit high, but he does seem genuinely unconscious, so I'm just going to check his sugars and then probably cannulate him and give him some naloxone. Go down the route that he might had heroin or something, some kind of opiate overdose.
The drug naloxone should reverse the impact of any opiates that may be in his system.
When he was on his back, did you see any head injury on the other side? Because all the blood's on this side. Can you open your eyes for me, mate? Can you try and squeeze my hand?
"20 miles away in Dartford, Special Sergeant Kevin and paramedic Aisha are responding to another call for help.
So we're en route to an RTC that's report of a 51-year-old male who's been hit by a car that was travelling approximately 30 miles an hour. He's currently slipping in and out of consciousness and has got quite severe pain to his ribs.
Any kind of pedestrian versus car is more concerning than a car versus car. Obviously, as a pedestrian, you're not as protected. You don't have all the metal around you that you do in a car.
C-cam aren't aware whether the car's still on scene or not.
They arrive at the location they've been given, but surprisingly find an empty road.
GR01 control, and we've just got to the location. Can't see any patients or any evidence of any accidents.
Just want to see if there's any other information regarding location. One moment. I think the patient actually was involved in an RTC earlier, has gone home and is inside the property.
Oh, okay, so this hasn't just happened? Okay, we're outside so I can just knock. It's a friend that's called, so we think that maybe they might be one of these properties, so we're just going to have a knock and see if we can find out what's gone on. Hello?
Hiya.
Hello?
Oh, yeah, I'll just go get it. He's in and out of sleep.
Tell me exactly what's happened.
I walked out behind my dad's car.
Yeah.
And as soon as I walked out, bang, for it.
Okay,
So...
so...
spun him round. That knee hit him first.
Right.
Spun him round in a circle.
And did you hit the floor?
Yeah, the floor.
Okay, so I'm just trying to gauge how the vehicle's hit you. Did it hit your face on the side?
On the side.
So on this side, and then you on that side, and then. I know, darling, but we need to do this in a certain way, okay? I need to make sure that there's no other injuries that you're not feeling at the moment. Can I lift your top up and have a look at your chest? I just need to feel around your bones, all right?
While Aisha treats her patient, Kevin starts his investigation into the incident, which is starting to look like a hit and run, a serious criminal offence.
I'll have a wander around, just see if we can see anything. We just need to establish what's happened or what the van is, if I can find any Ring doorbell that can identify the van, because we've got no details on that driver.
My knees broke. I swear to God, something's not right.
With the man clearly in distress, Aisha has called in an ambulance.
You're going to be all right, Tony, OK? We're going to look after you.
It's all right.
I'm all right. Always be all right.
Yeah.
There's nothing to worry about. When we panic, you can panic, all right? So he's got some pain in his ribs at the moment. Doesn't feel like they're broken, but might need an X-ray. The main pain that he's complaining of is in his knee, so we need to get a proper look at that. So in order to do that, we need to cut his trousers off. With that kind of speed, he's going to need to go to hospital at the end of the day to have a proper check, because it's quite significant being hit at 30 miles an hour as a pedestrian. Whereabouts in your knee is the pain? Or is it just the whole knee? All right. I need to feel it. Would you like some gas and air while I'm assessing that?
Please.
Where is...
I'm not a coward, but...
Oh, no, it's all right. I know you're in pain, darling. Where's Kev? Is he still here?
Kevin is still hunting for footage showing a registration number so he can identify the driver who's left the scene.
Hello, there's nothing to be concerned about. There was a road traffic collision just down the road, probably about an hour and a half ago. The vehicle that hit the pedestrian came this way. Do you think your camera would have picked up anything I could have a look at?
It seems the homeowner may have the vital footage.
Yeah, it's quite a good view, isn't it?
His heart rate's a bit high, some kind of opiate overdose.
The JRU team are dealing with an unconscious man who's reported to have attempted to steal a car and is a known heroin user.
Can you open your eyes for me, mate? Can you try and squeeze my hand? I do think it is probably drugs. Right, bit of a scratch.
Obviously, preserving his life, I think, is the main priority at the moment. And then we can deal with any sort of offences later on.
A heroin overdose can be fatal, and the team have moved fast to inject the man with a medicine called naloxone that should reverse its effects.
And hopefully that should make him more arousable.
But so far, it's not working.
And he's a known heroin user, so I've given him 2 doses of naloxone now, 1 IM, 2nd IV, and obviously just seeing if that will rouse him. He's tolerating an OP. I still think, just because of head injury and I don't know the impact, maybe if we get scoop. So level response is coming up now.
Suddenly, Jordan feels the man moving.
Can you talk to me a little bit? You're cold. We're going to get you onto the ambulance. Does your head hurt? Have you got any pain in your head? Yeah? Try and keep your eyes open. Talk to me. Yeah, so he's obviously had naloxone, and quite soon after giving it, within a minute, he started to open his eyes and move a bit more. So that's a good indication that he has had an overdose and the drug that reverses it is working. Have you got any pain anywhere?
No.
Where's your pain?
My face.
Your face. Have you got any in your neck at all?
Not my head.
Okay, where in your head? Do you think you can sit up and point to me? Is it at the top of your head? Where my hand is? Yeah? Okay, any in your eyes? You can't talk? Okay. He's still breathing okay for himself. The only reason I really wanted to get that naloxone in was to make sure that that was the reason he was unconscious, and now I'm quite confident it is.
Now Jordan knows that the man's behaviour is due to drugs and not to a head injury. He can begin the move to A&E.
Can we sit up? Hello? Whoa, whoa.
Mind his head.
Is your head still hurting? Yeah, there we go. Should we try and sit up? Should we try and get on the ambulance where it's warmer? Talk to me. Open your eyes for me. Shall we get you onto the ambulance? Try and sit up for me. Let's stand up. Ready? Good. If we get him on his side, this way. Yeah. So his level of consciousness is fluctuating with the drug I've given, but his observations are still okay. So we're just going to probably blue light him into hospital due to his level of consciousness, and might have to give repeated doses of that naloxone on the way. So he's better than he was, so we are able to monitor his consciousness and improve it. But if he were to keep dropping off like that, he could potentially drop off and just stop breathing altogether. So he's still a concern for us.
While Jordan has been dealing with the man's injuries, Hannah and her police colleagues are trying to get to the bottom of what happened.
The gentleman that's in the back of the ambulance has been found in a vehicle that doesn't belong to him, so obviously somebody's found him, wasn't very happy. The officers on the scene do know this gentleman, and apparently he does use this technique quite often, stealing from cars to fund his drug habits.
It seems the man has been attacked for trying to steal something from the car.
This gentleman, in terms of his facial injuries, he has probably fractured his nose, but he's at least got lacerations to the bridge of his nose that will need stitching or gluing. But from an ambulance point of view, we just need to get him to hospital now so he can get treated properly. When they're unconscious like that, it can be very nerve-wracking as a clinician on your own, but luckily Hannah was able to get me all the equipment I needed. She knew what everything was called, so that made it a lot smoother. But that's why it's lucky when you have an officer that's experienced working with the JRU, because they can help set things up so I'm not doing everything on my own, and that way I can actually monitor the patient properly until the other crew gets there.
In Dartford, Special Sergeant Kevin is investigating the claim that a man has been injured by a hit-and-run driver.
The van's driven down this way.
His search for clues has led him to some video evidence footage of the accident taken by a neighbour's doorbell camera.
Now, at the moment, I saw a van matches the description, but unfortunately, I can't see that it was involved in an accident. It just looks like it pulled out from the house just up the road.
Kevin can't be sure if he's got the right vehicle, but this could be a vital breakthrough.
Top premiums.
The man who's been knocked down is being checked over in his home by paramedic Aisha.
They don't feel like they're broken. When you feel bones, if they're broken, you can normally feel sort of a little bit of a crackling sensation under the skin, but you've got a lot of muscles in that area. Yeah. And if you've hurt those muscles, it's gonna be really painful. Sorry, Tony, I just need to feel all around your head, make sure you've got no bumps.
It's not me, it's my heart that hurts.
Your heart hurts?
Yeah.
Whereabouts in your chest is that pain?
ribs.
Your ribs. How much pain are you in at the moment out of 10?
About 9.5.
All right. Do you mind if while the officer's speaking to you, I pop a little cannula in, a little needle?
Give me some pain relief, please.
Yeah.
That's all right. It's all right. So,
I need to try and get a proper blood pressure. So whilst Kevin's talking, I need you to keep.
So you're crossing out. You're coming out your drive.
Yeah. They were doing a wheelie on the motorbike. I was angry and I walked out, went to kick him off it, but I didn't see the car behind. Right, mate.
Was it a car or a van?
With the van.
Is this the van here? Is that the van there?
Yeah.
That's the van, is it?
Must
That
be,
one there.
Must be, yeah.
Kevin now has a visual confirmation that it was the van that hit him.
So his blood pressure's quite high, which is a little bit of a concern considering he has hit his head and he's previously had a bleed on the brain. So a little bit concerned that that is so high.
Concerned about his potential head injury,
Right, all your weight free, a good one, all right?
Aisha has directed the ambulance to take Tony to Princess Royal Orpington, which has facilities for specialist neurological examinations.
Well done. Right, and I'll give you a hand with your legs, all right? We've chosen to take him to a hospital that deals with both trauma and neurological conditions. His blood pressure's still really high at the moment. He is going to need some x-rays, some scans in hospital, make sure there's nothing further going on there. Keep an eye on him, try and get that blood pressure down and just make sure there's nothing going on like a bleed on the brain.
Road traffic accidents involving pedestrians will often end up in a 999 call. But head-on collisions between cars can also lead to life-threatening injuries. Special Sergeant John and paramedic Alex have been called to an RTC.
One 18-year-old and one 30-year-old head-on collision. One patient has chest injuries. The notes that we've both got sound like it's quite a large RTC with probably quite a bit of damage to the car.
Kent is one of the most dangerous counties for driving in England, with over 50,000 reported accidents in the last 10 years.
Yeah. I can see the car here, it looks fairly damaged, side impact as well. So we'll grab some kit and go and check them over.
It's such a serious collision that several police units have been called to assist with the aftermath.
I mean, like, big chunks of metal that's come off of this.
Yeah.
It's just shredded it.
One of the drivers is reported to have been hurt in the crash, but it's not known yet how badly. The other is refusing to be assessed. As the first paramedic on scene, it's vital that Alex sees both drivers immediately, as there could be serious injuries. The JRU team of paramedic Nathan and Special Officer Jack
Yeah, I'll receive. Thank you.
are on patrol and have been asked to help search for a suspected thief in the area.
A chap has been seen to break into a car, take someone's wallet, and the owner of the car has seen him do it, has chased him, grabbed his wallet back, and he can still see the suspect along the road. So we'll go and see if we can find him. I don't see anyone.
I believe last seen by the car dealership near the alleyway there.
There he is.
There he is, yeah, go.
As they turn a corner, they spot something.
03 males running up Maidstone Road. So go on. Oi, stay there. Get here. Get here. Get here. Jump over here.
That's my mate.
Are you sure? Are you sure? Stay there, stay there, stay there.
That's my mate.
You sure?
Yeah.
All right.
But the man they stopped isn't the thief. He's one of the good guys, a friend of the person whose car was broken into.
The victim's friends are out having a look for him, and he matched the description to a T. So as we pulled up, luckily his mates were there and said that it wasn't him.
The thief may still be on the run, but at least the victim of the robbery managed to take a picture of him as he ran away.
Go on, let's have a look. If it's who I think it is.
He's got a cut across his nose.
And Jack may know him.
I'm pretty sure it is.
The suspect is a one-man crime wave, a known heroin addict who repeatedly breaks into cars in the county. In fact, it's the same person Jack's colleagues Hannah and Jordan dealt with just 2 days ago.
Can you open your eyes for me, mate?
He'd been assaulted while allegedly breaking into a car, which explains the facial injuries the 999 caller had described tonight.
I saw him in custody the other day. The usual MO for this guy, that I think it might be, is that he'll just go around, he'll smash windows for cars, just put his hand in and see what he can get. So if people leave a phone lying around, a wallet, a sat-nav or something like that, he'll just have the window in and away he goes, and you know, he could do 10 cars in an hour.
It's now more than 10 minutes since the 999 call came in, and the chances of finding the suspect are getting slimmer.
Just carry on having an area search, see if we can find him, but there's so many little roads around here that it's unlikely.
After a lengthy and unsuccessful search of the area, Jack and Nathan decide to pull into a petrol station for a breather. At which point, Jack suddenly spots someone.
Yeah, that last job I just dealt with, I think I can see the suspect at the co-op. You got any units that are close by?
Stand by 1.
The suspected car thief is on the forecourt in front of them.
Yeah, now.
In North Kent, JRU Special Sergeant John and paramedic Alex are at a road traffic collision. One of the two drivers has been detained and is still refusing medical assessment.
If you feel okay and you don't have any injuries, then... No? Okay, I'll let you do if any problems, then let me know.
While the other was reported to be injured.
Hello, mate.
I'm okay. I've got a bit of chest pain from when nothing come in the car, the airbags went off.
All right.
Despite the impact, both drivers have miraculously walked away from the crash.
Do you remember everything happening?
I remember being very surreal. Just basically, I've spun and I stopped. I got out immediately. And absolutely fine.
Fine. So you've got no loss of consciousness at all. Any pain anywhere at the minute?
When the airbags went off and just hit me straight in the chest.
Okay.
Whilst Alex checks over the young man, John goes to inspect the damage to the other car, whose driver is alleged to have caused the accident.
The driver of the BMW is very lucky to be walking away. Yeah, very fortunate. So I think this is probably quite a high-speed collision.
Suspecting he may be over the limit, the driver of the crashed white BMW is now being breathalyzed.
It hasn't worked, all right. So the time is 23:50. Okay, at the moment I'm arresting you for failing to provide specimen of breath. Yeah, okay, so you can actually say anything. Well, I've asked him to provide a specimen of breath. He's tried it on 4 occasions where he just seems to be extremely struggling with just following basic instructions of blowing out onto the breath test. But personally, I think you're drunk. Okay. So, I've arrested him for failing to provide. Okay. You want to shut me your hands, mate, all right? I can smell alcohol on him. He said he's had an alcoholic drink. Or either try another breath test back there or use other means, either urine or blood, basically.
As the driver of the BMW is arrested for failing to provide a specimen of breath, the Corsa driver is still being checked over by Alex.
Take a deep breath in for me. Does that hurt at all? Whereabouts is it hurting? In the centre. Okay.
It hurts more when I breathe.
Do you think your chest hit the steering wheel at all, or was it?
Honestly, to be honest with you, all I remember is the car. When you hit in the car, going off, and I'm just spinning, and I get out, and I'm trying to find my phone, and I run over. I couldn't find my phone. I run over to the other driver to check he's conscious and he's okay. And I'm trying to wait people down to stop.
Small chance that you could have the fractured ribs. It's where the seatbelt went over, I think. So you may well get some bruising. Take some paracetamol when you get home, definitely, because as your adrenaline wears off, you're probably going to become a bit more uncomfortable. If your breathing starts to become quite laboured or you're struggling to catch your breath, which is really painful when you breathe, pop yourself to hospital, or if in doubt, give us a call back.
For Special Sergeant John, there's still work to be done.
We've now got to start the clean-up, which is going to involve recovery, coming down, taking both the cars, because at the moment the highway's closed. Even though the time of night, it's still causing a bit of traffic. The driver of the BMW is very lucky to be walking away. I mean, you can see that he's taken out a lamppost as well. All the airbags seem to have been deployed on the car, and you can see where he's collided, and it's probably a write-off of a rather nice car.
Stand by 1.
Police Officer Jack has tracked down a suspected car thief to a petrol station.
Right, you're under arrest on suspicion of theft of a motor vehicle. You don't have to say anything may harm the offence when there's no question.
To prove he's the thief, Jack needs to search him.
Wait, what you got in your pocket then?
Nothing in my pocket.
What have you got in your pocket?
Nothing in my pocket. No.
Well, stop struggling then.
No, before, no.
No.
Stop.
Stop struggling then, because you're going to get put on the floor.
They suspect the man is armed. Paramedic Nathan's needed to help with the search.
No, I tell you what, he's got screwdrivers in there. Just hold his hand. You just cut it this. Screwdriver. Pliers.
The suspect is well known to Jack as a serial car thief.
How many times do I have to meet you like this? You break into cars and we catch you. Are you breaching your bail as well? You are, aren't you?
So we just pulled over to have a drink after that job, just to have a little break, really. And then just so happened that he's chosen the wrong co-op to walk past. Jack's gone and arrested him for going equipped and everything else that he's been involved in. Apparently he's known to break into cars quite frequently.
Stand up.
Yeah.
Watch your head.
I want an ambulance, please.
I've got a paramedic here.
What's my head, please?
What do you want me to do to your head?
Someone in, I don't know what's the code.
Punch you in the head.
What's the code this?
Metal?
Yes, in the hand.
Oh, okay, and hit you in the head with metal?
Yeah.
Yeah?
Do you use crack, do you? Do you use crack?
No.
What do you put in there then? It's a crack pipe.
I car.
Keep your hands out your pockets.
Yeah. Too many police looking for me.
Well, stop breaking into cars then.
No. Too many police running over me, arrest me.
Well, stop breaking into cars then. Well, the time is 23:22 and you're further arrested for going equipped to steal, okay? Because I found pliers.
I will not buy what.
No, you're not.
Money.
No.
My money.
No. How do I know? It's not your money.
Yes, my
Somebody else's bank card.
No bank. Cash, I go cash.
No. Not having it. Sit down.
I'm not running.
I know you're not going to run. Because I'll catch you.
A police unit arrives to take the suspect away.
Can we just sit him in the back of there? Nathan's going to check his head.
As soon as Nathan's given him the once-over.
He's got in a scuffle with someone, isn't he?
Once he's in the car, the suspect claims his injury has worsened.
What are you doing? Oi, sit up. Oi. Sit up. Sit up.
My head, I can't.
Sit up.
My head.
Yes, you can.
I can't.
Mate, you've just been sitting up. Oi, the paramedics can't look at you whilst you're laying down.
Joint response.
Sit up.
Okay, so I'll be good. You want to be with me?
No, the paramedic's going to come and check your head.
Yeah. That's right. It's a tiny little cut.
He's got about 5 different
tiny
pairs of sunglasses.
You bleed a lot from your head.
As he's examined by Nathan, Jack continues to search his bag.
I just want to see what else is in here. This is really heavy. Oh, there it is.
It's a knife, isn't it? Yeah, go on, please.
Ah. Got a Stanley blade on him. He's already been arrested for going equipped to steal. We found pliers, screwdriver, and now we've just found the Stanley blade on him. Probably all under the same umbrella. We know he's out breaking into cars, cutting into cars. So we'll be taken off to custody, be booked into custody, and then we can go back and I can go back and do our bits.
It's like a graze. It's a little graze. So he's got a very minor head graze, really. It's bled a little bit and he's got a bit of dry blood down his head, but nothing much really going on there. So custody nurse will be able to look after him there. He's going to go there now and they'll be able to keep an eye on him overnight as he's being dealt with there, with whatever he's done or hasn't done.
But just as the suspect's about to be driven to the cells...
Yeah, Nath, we're going to get him out.
Yeah.
Nathan's needed again.
Pull him backwards.
Here you go, you ready?
The man's passed out and is completely unresponsive.
003 CCAM. Can I get a grade 2, please? His arm out of sleeve. Got a shallow breathing. His pupils were all right earlier. In the second.
With drink drivers causing more than 200 deaths on UK roads each year, the JRU teams are constantly on the alert for people driving over the legal limit.
Take brakes off. No, you've got no lights in the back at all.
Police officer Ben and paramedic Lisa have stopped a car which was being driven with no lights on.
She's put her foot back on the brake again.
Take first break, love.
Right, no, they're off.
The female driver seems to be confused.
Have you been drinking tonight at all? No?
No.
No?
That's one glass, it's fine.
One glass of wine? Sorry? OK, can you turn the engine off for me, please, madam? Come over here to the pavement for me. What's your name? Well, the fact you're driving no lights on and I can smell alcohol and you told me you've had a glass of wine. So what I'm going to do, I'm going to require you to provide the sample of breath for the purpose of our breath test. If you fail to do so, or refuse to do so, it may make you liable to arrest the prosecution. Do you understand that? Yeah, any medical reason why you cannot supply with a sample of breath?
No.
None at all, OK. Right. Take a deep breath and blow for me, please. Keep going, keep going, keep going, keep going, keep going, okay? Thank you very much. OK, the result was 76. At this moment in time, you're under arrest. Suspicion of driving whilst over the prescribed limit. You were taken back to the police station where I'll place you on a machine which will tell me the exact amount of alcohol in your system. At this moment in time, you have blown 76. Legal limit is 35. OK? Could you do me a favour? Park it, please.
The driver has blown more than twice the legal limit.
Do you have a spare unit, please? I've got one in custody.
The thought of being locked up is hitting home.
All right, calm down for me. We're not going to hurt you, we're going to look after you. All right? Right, what's your first name? No, it's not the end at all.
Would be helpful.
It's not the end at all. It is not the end at all.
My mum would be so ashamed of me.
But there is little sympathy, and the woman will be taken directly to the police station.
What's happening?
If you come with me, I'll show you. I'll explain to you. Right. These gentlemen here, OK, you're going to sit in the back of the car with them, OK? This gentleman will sit in the back with you. I will follow you to the police station. She's upset, but to be honest, I have little tolerance for drink drivers. I see the worst thing that happen when drink drivers kill people or themselves. And I know, I appreciate people make mistakes, but there are ways of getting help than going out and drink driving.
His arm out of sleeve? Yeah, he got shallow breathing.
A man arrested on suspicion of theft has passed out as he was about to be taken into custody.
You've got good pulses, so...
Say again?
Got good pulses. Was it a crack pipe, did you find? Yeah.
It's the same man another JRU team dealt with 2 days previously.
So he's known to you guys being a heroin user?
Yes.
Yeah.
After he was allegedly beaten up by someone who caught him breaking into their car.
Yeah.
He has got quite a lot of previous for theft from motor vehicles. That's how he tends to fund his habit.
His pupils were all right earlier.
5 minutes after he first passed out, paramedic Nathan has managed to rouse him.
Oh, you're back with us. What happened? Where'd you go?
Hello, mate. Keep your arm still a sec.
Yeah,
keep your arm still, mate.
Keep your arm still.
Keep your arm still. So just checking him over, see what's going on, see if we can figure out why he went unconscious. All his checks come back absolutely spot on. So just waiting for another blood pressure to come back just to make sure it's not an abnormality. He's taken some drugs before we've got here. Did have a crack pipe on him, so... He's spinning. Can you see stars? You're gonna be sick? You're gonna be sick. Alright, yeah. A little bit. Have you taken heroin tonight?
No.
Sure? It makes a big difference to your medical treatment.
Listen, if you have taken heroin, just tell us. You're not going to get in any trouble for that.
I know.
You know, yeah?
Yeah,
Have you taken any?
No, I don't take it.
What have you taken? Nothing?
Oh.
Even though the man's denying taking heroin, Nathan suspects he has.
Sharp scratch.
Nice and still, nice and still.
So we're going to give him an anti-sickness, just because we're retching quite a lot. See if that helps with that, hopefully. And then give him some pain relief as well. So he's been assaulted, hit around the head. He was absolutely fine. Was about to go to custody, and then went unconscious in the car.
Well, keep yourself still, keep yourself still. There we go. That's it.
It does appear that he genuinely was unconscious for a short period of time. Yes, he's under arrest, but, you know, we've got to look after him as well. We know that he uses heroin, so the likelihood is he could have just used heroin just prior to his arrest, which is what's made him have this turn.
We're going to go to hospital. We're just waiting for the ambulance to come.
Nathan administers Narcan, otherwise known as naloxone, a medicine that rapidly reverses an opioid overdose. Nathan's fellow paramedic Jordan did exactly the same 2 days ago.
Just going to give him some naloxone.
When he found the man unconscious.
Your pupils were very little when you stopped responding properly, and your breathing went a bit slower.
Yes, that can go down to police dealing.
I'm just going through his property and bagging it all up for the evidence. Screwdriver, wire cutters, torch, bank card in somebody else's name that's not his, umpteen pairs of sunglasses.
The suspected thief needs to go to hospital before he goes to custody.
So he was put under arrest, and then in the back of the car he went unconscious for like 2 to 3 minutes, but like proper unconscious, wasn't responding. Yeah. You sure you're comfortable down there? You don't want to sit up? So he's going to A&E now to try and get to the bottom of kind of why he's gone unconscious. He's still under arrest, so once he's done there, he'll go down to custody and be sorted out there by the police. So, yeah, all in all, quite a good job.
Yes, Nathan did say, is that him? DP Nathan, detective paramedic.
I'll take it. I've been called worse things.
Right, let's get back to custody.
Get in.
In the UK, there are more than 2 million people aged over 75 living alone. Paramedic Aisha and Special Sergeant Jack are on their way to one of them.
We're going to an 89-year-old female who lives alone and has pressed her lifeline, which is something that's connected to their home landline telephone. If they press it, someone will be on the other end of it to answer, see if they need anything. And in this instance, they haven't been able to get hold of the person who's pressed it. So because there's been no response, they'll pass it through to the ambulance service.
We get a lot of lifeline presses. We go to a lot of people that have fallen over, unable to get themselves up. They've got their alarm on them.
1 in 3 people aged over 65 will have at least one fall in a year, and 100,000 of them break a hip.
It's just there. Let's see if I can get an answer quickly. Hello. You're right. Ambulance is here as well.
Oh, right, okay.
The patient's daughter and son-in-law have arrived just minutes before Jack and Aisha.
Sorry, darling. Have you got any pain anywhere?
No.
OK, darling. I'm just going to step over you and feel your wrist, if that's OK. OK, well done, sweetheart. And when did you fall? How long ago? Was it when you pressed your lifeline?
About 9 o'clock, I suppose.
OK. And you haven't got any pain in your neck at all?
No, it's been aching anyway.
Right, how much strength do you have in your legs?
Not a lot.
We're going to do most of the work. So that right leg, I need you to bend it at the knee for me and get your foot as flat as you can. And then Jack's going to put his foot in front of yours so they don't slip.
I don't know why. I wanted to go to the pad out of the wardrobe and I slipped.
Right, so...
You're going to hold on to me and not the radiator?
Yeah.
Hold on.
3. 1, 2, 3. We've got you.
We got you.
That's it, have a hurt.
Don't slip
hang on a minute, we're going to do the
Stay
same thing again.
Stay there, stay there.
We're going to get you a chair with a back on it, all right?
You stay there. Thank you.
Now Iris is off the floor.
That's better. We can see your pretty face now.
Aisha can begin to check her over and find out what might have caused her to fall.
Right, sweetheart. Is it OK if I do some observations on you? Your pulse, blood pressure? Yeah? OK, yeah. Iris, are you feeling breathless? Be honest with me, darling.
I do get a bit breathless.
Okay.
Iris's breathing difficulties might mean something more serious is going on.
So, sweetheart, so I think that you've got something called atrial fibrillation, and it just means your heart rate's a little bit irregular, which normally isn't a problem. But tonight it's going into a bit of a quick rhythm. So because of that, darling, I'm going to suggest a trip up to hospital. I know you don't want to go, darling. But listen, sweetheart. Listen. But with your heart rate going a little bit quick, I'm concerned that it might start going too quick. Okay? And we're sort of getting towards it being a bit too quick at the moment.
I don't want to go.
I know you don't, darling. We need the hospital just to give you some medications to slow that heart rate down, and then they can send you home with some antibiotics. They won't keep you any longer than they need to.
You all right? Persuading elderly patients to go to hospital is often the tricky part. Jack helps Iris into her living room, which is more accessible for the ambulance crew that's been called.
Her heart is going far too quickly. That's not giving her heart a chance to completely empty the blood from the top chambers to the bottom chambers and into the body and the lungs. You're right, sweetheart.
18 minutes after they're called, the ambulance crew arrives.
What made me think there was something more going on, she was sitting there very breathless. And so blood pressure has dropped. We were at 150 over 80-ish.
Iris, my colleague's going to move the ambulance and bring your chair in. I'll bring you a blanket as well. Are you happy to come? I know you don't want to go, but it's certainly for the best.
Iris will be checked over at A&E, just a short 10-minute drive away.
Iris, I hope you feel better soon, darling, and I really am sorry you've got to go to hospital. But fingers crossed it'll be a quick one, all right? Thank you very much, guys. Thank you. All right, take care. Bye-bye. Thank you. You're welcome. They can be quite hard, emotionally tough, those sort of jobs. Nobody likes to go to an elderly person who's that upset. It makes you think of, you know, your grandparents, your parents, so it is tough. But ultimately, we've done the right thing, you know, kind of bringing her around to the idea of going into hospital and just making her understand the necessity of it. They won't keep you any longer than they need to.
Speak soon. Get your hands out.
Can we sit up? Well. Let's stand up. Ready? Good.
How much pain are you in right now? Okay.
It hurts more when I breathe.
Top 3 ribs is.
Oh, yeah, thank God. All right. No,
Top 3 ribs. Them ones.
Police!
Urgent assistance.
In modern Britain,
There's been a big accident.
the most dramatic 999 calls
The car is now on fire.
often require not one, but 2 emergency responders.
I'm a police officer, she's a paramedic.
In Kent, one of Britain's biggest counties,
I'm just thinking if we just cover it all.
a groundbreaking joint response unit has been formed,
Ready, set, lift.
where both police and paramedic combine in one specialist vehicle
You've been arrested for assault.
to answer some of the most extreme 999 calls.
Right, stand clear. Everyone clear? Shocked.
We already outdone ourselves on that one.
Face the wall.
Mate, I can't believe we got him.
Coming up, a driver found unconscious at the wheel.
His pupils are not moving at all.
An escaped cow causes havoc.
I don't want it to run at me.
And a race for a baby in serious trouble.
That's a C1 for a paediatric fitting.
Kent's Joint Response Unit saved time and money by having dual emergency services in one high-performance response car.
JR01 Control, being asked to attend a police CAD in Dartford. Could you pop it through?
Since 2019, the unit's responded to over 12,000 incidents requiring urgent police and medical assistance.
Just putting that through now, over.
Amazing, thank you very much.
It's 7:50 p.m. Paramedic Aisha and Special Sergeant Kevin are called to an incident in the middle of a residential street.
So there's a report of a male and female that have been arguing. It's going down as a domestic incident. An elderly lady is in between them trying to break them up. It could potentially escalate into something more serious if the description of the male is white skin, white and black top, and then the female, white skin, wearing all black. We've arrived at the incident and we're just in a direct location that we were given. There's no one about apart from a few people playing basketball.
The couple have disappeared, but then something else catches Kev's watchful eye. A car crosses their path with its lights off.
Stick your sirens on, mate. Just gonna have a quick chat because they need to have the lights on.
And just when they think the car has pulled over,
Are they going to actually stop?
it's off again.
They look like they are about to...
Yeah, Juliet Romeo 1 priority.
Go, Kev, go, 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 go.
Stop!
While Special Sergeant Kev chases on foot,
Juliet Romeo 1 priority, mate, I'm making off. Can we get your phone, mate?
Paramedic Aisha assists alongside in the patrol car until the runaway disappears down the side of a house.
Where's he gone?
Unfortunately, they are a little bit quicker than me, so they managed to get away. But at the moment, I've got other units en route to see if we can track these males down.
"23 miles away in the Kent countryside on the outskirts of Faversham, Paramedic Daniel and Special Sergeant James are chasing another fugitive. But this one has 4 legs.
We're on our way to assist some colleagues to a cow which is on the carriageway. But we're going to go down there and assist them so we can get it back to its field and move it on.
Move it on! That was so bad. That was so bad, James.
Reported to be on a 60-mile-an-hour road, a loose cow in traffic is a danger to everyone.
If it gets hit by a car, I mean, it can cause quite a bit of damage to the car and obviously injure the people inside. If it bolts for anyone, it can cause injury. So for the welfare of the animal and obviously the safety of the public, it's quite important to go into it. I hope she'll get it back in the field. I think the stakes are high. So.
Oh, no! James, stop it!
A single crewed officer at the scene has been trying to contain the animal.
Oh, yes, the cow, or the bullet has escaped from the impromptu pen I've got. I'm just after it down Faversham Road towards Gravesend.
Where on earth can they be? I'm just half expecting this bloody ball now to be running in our direction.
As they near the location, finding both cow and police crew is proving tricky, even with a second unit called in to help.
No.
No.
Yeah.
Because driving down, I can see flashing lights over there.
We've literally come straight from, so...
We'll follow you.
The local back to the farm I ran, unfortunately, he doesn't have any cattle.
And we can't find this cow or this other unit, so...
4444, you should have an image of that male.
Either we've not gone far enough, or they're not where they say they are. So we're just going to follow these until we find a cow.
A few minutes later, they find their escapee on a busy country road leading to a dual carriageway.
Oh, it's not a bull, is it? That's a cow.
With police cars blocking both ways.
I don't want it to run at me.
The cow is cornered and looking ready to charge.
I was going to panic.
Over in Dartford, Special Sergeant Kev is still trying to catch his two-legged runaways.
He's jumped a fence in someone's garden.
It's all right, well, can we go back to the car?
Yeah, of course.
Juliet Romeo 01.
Kev checks into control.
Yeah, it's a white male, dark bottoms and top tracksuit, black trainers.
I think the other one had light hair.
Just need to secure that car.
Oh, God.
Within minutes, extra patrol units and police dogs are at the scene, with reports coming in of a male hiding behind some houses.
Right, mate? Yeah, that sort of direction. Between the shops and over a fence.
The police try a containment move to trap the runaway driver, but that leaves paramedic Aisha alone on the street with the abandoned car.
Kev has gone off in pursuit of the young boys, so I'm going to stay here, make sure they don't come back to the car. So hopefully Kev will be back soon with an update.
Make sure camera's got an updated description.
In Dartford, a driver has been on the run from the police for over 10 minutes, leaving Joint Response paramedic Aisha watching over the abandoned car.
There was a male seen by another crew making off towards that way, so I just assisted doing a bit of an area search, hopping over the fence, seeing if we could locate him.
While other officers continue the hunt, Aisha's Joint Response colleague, Special Sergeant Kev, returns to examine the car for evidence.
Just seeing if there's anything stashed in the car that can identify them or identify why they've made off from police. At the moment, there's not really anything in the car that suggests why they've decided to do a bit of a runner. It could be something simple that the driver was potentially uninsured on the vehicle and they were a bit worried about that, so they've done a runner for that reason. Were they carrying something on their person that was illegal?
The search of the car is inconclusive, and the driver still at large.
I am sort of pushing 40 now. He's like mid-teens, early 20s, and he's a little bit quick. He's quite lightweight because he's in trainers and tracksuit, and I'm in full body armour, and you're probably talking a good, extra couple of kilos of weight, maybe a few more than that. And it, unfortunately, is the first person that's managed to get away from me. So I'll let him have that one. If I see him again, I might be a little bit fitter, and he probably won't get away.
But even though the young man managed to outrun him this time, the hunt is not over.
The male decided to run into a bit of a dead end, drop his phone, which I'm now going to seize as evidence. So we'll now take that. So if he wants it, he can come back to the police station to collect it.
It's a crucial bit of evidence, and the police will use the phone to help track down the driver. In Graveney, near the North Kent coast, paramedic Dan and Special Sergeant James have located the cow causing havoc around Kent's roads. Working with 2 police units, they attempt to trap it between the 3 patrol cars.
I was going to panic.
I don't want it to run at me.
But the animal has other ideas.
No, so as you can see at the moment, the horse is trying to outsmart the police officers, but... The cow. Sorry, the cow. Look, he's done it, no, look.
The cow walks straight past the car blocking the road.
Come on, in your car. How have you let that get through?
So paramedic Dan, along with the 2nd police unit, race ahead.
Uh-oh. No, he ain't gonna jump over, is it? Surely not.
Attempting to box her in.
Oh dear.
We've got contact from the farmer, so we've got to just try and keep containment of it. Obviously, we are quite close to a dual carriageway. We can just try and contain it with the cars. Obviously, it's better the cars get kicked than us.
It's key they stop the cow. So the two cars attempt a dual stop maneuver.
Hello.
Yeah, go ahead,
Hello.
Just walked through the middle of the two cars, took both our windmills out. We just thought, oh, we don't care.
We just keep it in this circle, I think.
But after 30 minutes of life on the open road, the cow decides it's had enough of going around in circles.
Not down the ditch.
She's in a field. So unusual. You just can't write it, can you?
Just as her owner arrives.
Evening. Are we the farmer? Yeah. Oh, hello, farmer.
It may have taken 3 cars to see Daisy home, but at least a dangerous collision was avoided.
So really good news. The cow was obviously returned to its field. She made her own way back after obviously playing on the road for a little while.
Good job, guys. Well done.
Animal incidents happen occasionally. I'll probably count on one hand over the last couple of years the amount I've been to. Obviously, it's a nice job to deal with, really, isn't it? It's you know, no one's shouting and swearing at you. It's a job where, although she might not have been as compliant as we'd like her to have been, it was a job well done.
The Joint Response Units have the skills to attend to almost any type of life-threatening incident, from road traffic collisions to domestic assaults.
Yeah, we're going to for an RTC. So can you have a chat with me, please?
Yeah, of course, that's no problem at all.
3 minutes into their shift, Special Sergeant Hannah and Paramedic Nathan are called to a report of a driver lying unconscious.
I think it might be down in that car down there.
Juliet Romeo 01, control over. 01, control over.
No.
What's gone on? Yeah, they have crashed.
Any masks?
The car's smashed into a lamppost and the driver's out cold in his seat.
You all right? What's your name?
Let's sit you up, sir.
The man's unresponsive. Nathan has to quickly determine what's wrong.
Just go quickly check his sugar levels and then see what we can get from him. He responds a little bit to pain. Sorry, sir. 5.2, that's fine. I'll pop this in your ear.
Satisfied he's not in a diabetic coma, Nathan checks his blood pressure and body temperature.
How are you feeling, sir? Yeah. You want to grab me the drugs bag out the back?
Have we got it?
No, the red. Oh no, I haven't got a drugs bag, have I?
Got it. No.
There's a problem. Nathan is only just on shift, so he doesn't have all his paramedic drugs available yet.
Unfortunately, we've just started shift, so haven't been able to grab any drugs or anything yet. So we can start giving him fluids and potentially something called atropine as well, just to hopefully speed up his heart rate a little bit.
Worried about the driver's low heart rate, Nathan calls for backup.
I'll just go lie you down a bit, mate.
Juliet Romeo 03, go ahead.
I'm gonna have to put in a grade 1 because I haven't got a drugs bag or anything yet.
No worries at all. Get a crew on route to you now.
A grade 1 backup means Nathan needs an ambulance urgently.
Apart from being unconscious, he's a little bit hypertensive.
And time is critical. The Joint Response Units have a base in Rochester, ready to respond to emergencies across the county.
Evening. We're not too far from your Pennington Heath camp. Do you want us to go make a first and I'll let you know what's going on?
Oh, yes, please. This 15-year-old with a dodgy leg. Popping it through to you now.
Jumping on the call today are paramedic Alex and Special Sergeant and trained nurse Helen.
There is a young lad that appears to have broken his leg. We're going to go over and then Alex can do his first assessment and see if we can help this young lad So he must have been in an awful lot of pain.
Yeah, he's got a possible dislocated knee. His dad's on scene apparently as well. They've tried to get him up to put him in a car and take him to hospital, but he's in too much pain apparently to get there. So we're literally just down the road from this one. So what we can do is go and sort his pain out, do an assessment.
Yeah, he's worried.
What's happened then, sir?
I don't know if he's just standing there or whether he's walking, but he's sort of like when he come out at a funny.
Was he just? Were you with him when it happened? Were you? Or?
No, I wasn't. I tried picking him up, but now he's gone into a bit of a hot spot.
Okay.
Oh, that's a good angle, isn't it? I can see that from here.
While the team have a closer look, paramedic Nathan has called for emergency backup to give drugs to a driver found unconscious at the wheel. But whilst waiting for the ambulance to arrive, the man regains consciousness.
All right. How old are you, sir? So your heart has been going really slow and your blood pressure's dropped as well. So I think we're gonna have to get you to hospital, all right?
Minutes later, the ambulance arrives.
So Brady at 34, blood pressure was like 50-something. I don't think he'll be able to walk yet. His pupils, to start off with, were just freeze and just fixed and not moving at all. So I don't know whether he's definitely had, he's had some sort of like cardiac episode or something, whether it's caused by drugs or not.
Although the immediate medical emergency is over, the police investigation is just beginning.
I've got his ID, so we know who he is.
And 2 more special constables are briefed by Hannah.
He's, from what I've understood, been driving up here, hit the post. You can literally see the marks where he's gone straight in, but he's completely unconscious, out of it.
But whilst examining the car for evidence, Hannah makes a discovery.
Have you got any drug swipes?
Yes.
He's got a small quantity of cannabis in his bag. Lovely. It's a joint that's been rolled with cannabis. Yeah.
Cannabis in the car doesn't mean he's been driving under the influence, but he'll need to be tested.
So he's just going to be drug swiped at the earliest opportunity to see if he has got any cannabis or any other drugs in his system. Obviously that could be an indicator as to why this gentleman has crashed.
Before they can test his saliva for traces of any illegal drugs, the police wait for the all clear from paramedic Nathan.
Yeah, you do your bit.
Right, so what I need you to do is I need you to get your tongue and roll it around your mouth, all up against your gums and all against your lips, all right? Poke your tongue out for me, wide as you can, wide in your mouth.
So it could be drugs and alcohol related. He's only doing a couple of miles an hour apparently when he's crashed, so it's unlikely to be trauma related. Might be mental health related, a bit of psychosis maybe, could be some swelling from previous injuries. We're not too sure really what's causing it.
After completing the saliva drugs test, it's time for a breathalyzer.
Right, so I also require a specimen of breath off you, okay? Failure to provide a sufficient specimen of breath may render you liable to arrest, all right? Nice deep breath. Seal your lips around this tube for me. Seal your lips around the tube.
But the driver fails to comply with instructions.
Okay, are you going to provide me with a sample of breath or not?
Yeah, but mate, you can breathe, so you need to just blow into there.
You've got 100% oxygen levels.
Okay? Because they've said you are able to do that. Okay? So what you need to do, you need to blow into that tube. Go then, go, nice deep breath, blow. Ready?
And seal your lips around that
Go.
tube.
Blow.
Blow. Keep going, keep going, keep going. Insufficient. You need to keep going until I tell you to stop, all right? Right, are you going to provide me a sample of breath or not? We'll try, okay. If not, you get arrested, we take you down to custody and we get you on the evidential sample there.
The driver appears to be making things difficult, but they give him one last chance.
Right, are you ready or not? Right, deep breath.
You've got to blow.
Seal your lips and blow. Blow.
You're sucking.
You're not blowing, you're not blowing. No, fella,
Just lick him.
Time is 6:01 and I'm arresting you failing to provide a roadside breath sample, all right? You don't have to say anything, but it may harm your defence if you do not mention when questioned. Some of you may later on. Jet's been arrested under Section 4 of the Road Traffic Act. He's not provided a sufficient sample of breath, so we're going to take him back to custody once he's been to hospital and get him on the evidential breath test.
The driver's now under arrest, but he'll still need to go to hospital.
There's no reason he couldn't do that. He did start doing it and then he just stopped.
But first, Nathan has to work out just how to get him out of the car.
So we have two options. We can either you can get out yourself, so we can help you out, but you do it yourself, or we have to get fire out and they're going to have to cut your roof off.
Oh, that's a good angle, isn't it? I can see that from here.
In Maidstone,
Hello, mate. Is it Tom?
paramedic Alex and Special Constable Helen are in a park to help a young lad who can't move because of the pain in his twisted knee.
What's happened, mate?
I've landed on it and it just came out.
So you landed on your knee?
I didn't even land on it, I just literally landed on one way and it came out.
Were you playing tennis, were you?
No.
Oh, okay.
With the dog.
Oh, okay.
Oh.
Have you dislocated your knee before?
Nope.
No, so how much pain are you in?
I'll give it a 9 or 8.
9?
Yeah.
A dislocation occurs when a bone slips or pops out of a joint. Not only is it extremely painful, it will need to be treated so it doesn't cause damage to ligaments, nerves, or blood vessels.
Could I get a grade 2, please? You haven't had gas in there before, no?
No.
So it's what they give people when they have babies. It might make you feel like you're a bit drunk if you pop that in your mouth. You're in charge of it, mate. As much or as little as you want. As soon as you stop breathing it in, though, it wears off very, very quickly. I think what we're probably going to do, I'm going to see if I can get a quick needle in your arm, if that's all right, give you some morphine to help with the pain, and then we'll probably look to see if we can straighten your leg, and it looks like it's dislocated, and actually just by straightening your leg, we might be able to manipulate your kneecap back into place, and your pain will go instantly.
Great thing for a runner.
Oh, you're a runner, are you?
Yeah.
How old are you again?
15.
15.
Normally, Tom's kneecap glides over a groove in the joint, but because it's now sitting off at an angle, Alex needs to get him more comfortable.
Keep sucking on that.
Does it feel like it's helping?
Right, rest back and relax because you're going to get woozy. Just enjoy it. It's lovely stuff.
All right, be a sharp scratch, mate. All right, 1, 2, 3.
A dislocated knee is painful, so Alex attempts to fit a cannula to administer morphine, which acts on the central nervous system.
Where your hands are so cold, mate, your veins have disappeared.
When the body is warm, blood flow increases, dilating the veins and making them easier to find.
Not doing a very good job today, am I?
But after waiting for over 40 minutes on a cold court, finding Tom's are proving impossible.
Oh my God, veins just work.
Dodgy workman blames his tools, that's why. That's it, keep going like that for me. I want you to take really, really deep ones.
Alex's best option for pain relief remains the gas and air.
If you feel like you're about to pass out, that's okay. Nothing bad's going to happen, I promise, all right? Just having a look at it to assess to see if there's any possible breaks at all. It looks like quite a simple dislocation of the patella. So we're just going to get him some sort of as much of the ends knocked into his body as we can.
Once Tom's inhaled enough pain relief, Alex chooses the best time to straighten his leg.
Keep going.
Tom,
Big
this
breath.
is going to be a little bit uncomfortable, all right? So keep
Yeah,
going on
move
that gas and air.
quickly, keep going.
That's it.
Good lad. Keep going.
Just relax the leg for me, relax. There we go.
Alex pops the bone back in place.
Your knees back in.
I didn't realise that. I was
Yeah?
asleep.
It's wonderful.
That's good.
Isn't it? It's
That's
like
good
gas
stuff,
and
that.
air.
So your kneecap, as you probably know, was sort of round here. Yeah, so it was displaced laterally. I've just straightened your leg
funny,
out
isn't it?
and I've popped you back in and you'll be fine. But how's your pain now? So if you're 8 or 9 out of 10, can't feel it now. If I'm pressing that, does that hurt or?
No.
No? Good. We've done our job. So we've straightened his leg out, realigned his patella, so his kneecap back into normal alignment. His pain's now pretty much gone. We're just waiting for an ambulance to come to convey him to hospital.
A dislocated knee can take up to 6 weeks to heal, but there's a risk of it happening again if it's not had the chance to rest and repair properly.
I'll try and sit on that then. Yeah, that's
Get your bum as far up it as you can.
So Tom will have to take it easy.
High five for that. Well done.
Well, thanks. Don't like compliments.
A driver has been arrested for failing to provide a specimen of breath after crashing into a lamppost. He needs to go to hospital, but says he can't move, and paramedic Nathan has given him 2 choices to help get him out of the car.
You can get out yourself, so we can help you out, but you do it yourself, or we have to get fire out and they're gonna have to cut your roof off. That's the 2 options. Give me your hand.
I can't.
Well, you've been moving it freely a minute ago. Where does that hurt? In your back. Romeo 03 CCAM, can we get fire running to this for them to cut him out of the car, please?
Yeah, of course, no worries at all. I'll give fire a call now for you.
Lovely, thank you very much. He's complaining of back pain as well, and can't get himself out of the car, so we're just waiting for fire to come now to cut the roof off.
Whilst they wait for the fire crew,
Any like weed or anything?
the driver makes a confession.
So he's just said he's had copper on it.
So when we arrived, he was slumped over the wheel. He has come round a bit since then and admitted that he has had alcohol and he has had drugs.
The fire brigade has arrived to extract the driver, who says he can't get out of his car.
We're staff for a full prep for removal. No, perfect, thank you. Yeah, lovely, thank you very much.
So we've got 2 fire engines. Firefighters are currently taking the roof of his vehicle so the ambulance can instruct him. We've got 3 paramedics, we've got 3 police officers here. So all of us are here just working with this one male and trying to get him out of the vehicle and obviously sort out the scene.
Oh, I'm going to be putting that glass above your head. Yeah, that's all right.
Nathan's job is to keep his patient calm and still.
Exactly, that's the big worry. Yeah, so that's the biggest issue, isn't it? So in a minute, what we'll do is we're going to put a hard board down behind your back, pull you up onto it, and then lift you across onto our bed. All right? You're going to end up with a convertible now, all right? There we go, we've got a smile. Won't be long now, all right? Just focus on wiggling your toes. We're going to get the roof off now, all right? Yeah.
30 minutes later, they're finally able to carefully remove the driver.
Fire have cut the roof off nice and safely and managed to extricate him from the vehicle nice and safely as well, so it's all been done in a nice, timely manner.
In the ambulance, the crew check the driver over to try to work out if there's a medical reason for his behaviour.
I feel that.
Yeah, feel that?
I feel that.
He is feeling now. So he's got feeling back in his legs, which is a good thing. So he's going to go to the hospital, have some scans done, and go from there, really. It's a difficult one. It was just after they arrested him that all of a sudden his legs wouldn't work and his arms wouldn't work. So before that, he'd mentioned nothing about it. So whether that's just coincidence or whether that's actually something to do with it, we'll leave the hospital and the police to decide about that.
The JRU teams are made up of around 20 special constables from Kent Special Constabulary and a similar number of paramedics from the South East Coast Ambulance Service.
Looks like the rain's coming down, so there might be a few RTCs out there.
And they can sometimes find themselves working shifts with colleagues they've never met before.
No, never crewed up together before, so yeah, we'll see how it goes.
Luckiest lady in Kent right there.
We'll see. Hopefully it'll be a good day.
It's 2 p.m. and the beginning of a 12-hour shift for Joint Response Team Special Constable Tom and Paramedic Aisha.
Just a slow start.
Yeah.
Just the build-up for everything going absolutely wrong later on, probably.
I'm sure it will. There's a call coming to both ambulance and police. A car has crashed into a stationary car, we believe. So we've got a 31-year-old male who was the driver. Currently saying that he has chest pain and lower back pain, and the road is blocked. So certainly one for both of us.
Oh, is that it?
Hello, you alright? Good blimey. Wasn't expecting both.
Oh, I know. What's happened then?
Vehicle 1, which is the
Astra.
Oh.
Someone's walked in front of him on the crossing.
Right.
He's braked hard. Vehicle 2's hit vehicle 1. The only injured party is the one in the black car who's complaining of it.
Right, okay, we'll go.
All right, get some stuff together.
It appears the driver of a black Mazda came off worse in a 3-car pileup when he braked at a pedestrian crossing.
Hello, mate. Hello. What's your name? Nigel. My name's Ice. I'm a paramedic. Right. Where are you hurting at the moment, Nigel?
So I've got a back problem anyway.
Okay.
In my lower back, I've got a fractured bulging disc in my back. I initially jumped out of the car.
Yeah.
And then just the pain hit me in my back, my right shoulder, and here in my chest.
Okay. All right. I'm going to come around the other side of the vehicle and feel down your back. Is that okay? Yeah.
A further spinal injury could result in permanent nerve damage or even paralysis, so it's crucial Aisha examines Nigel further. While Tom investigates the man who rear-ended Nigel's car.
Because you've been involved in the road traffic police, I'm going to be requiring you to provide me with a specimen of breath here at the roadside. So, long, hard, continuous breath. Keep going, keep going, keep going, keep going, keep going, keep going. Yep, that's fine, thank you very much. Okay, so we'll just wait for this result to come back.
Right, so I want you to try and keep nice and still for me. I want you to tell me if there's any sharp pains when I'm pushing on any of the bones. I know it's lower, but I'm going to go down the entire spine, okay? Okay. Okay, all right, darling, all right. So we've got to be very careful with the spine, so going to keep him in the exact position he is at the moment until we get a crew here with some immobilisation kit.
If Nigel has damaged his spinal cord, he's at risk of permanent paralysis. In Kent, between 2020 and 2022, an average of 4 assaults a day were committed against the police, whilst attempting to arrest offenders or protect the public.
Romeo 04 Seacam, could you assign us to CAD 4763, please?
Yeah, we'll just that through for you now.
And today, it's JRU team, paramedic Nathan and Special Sergeant John called to assist with an aggressive man.
So we are on way to a patient who has been tasered by police. When police have turned up, he's pulled out a weapon and then he's tried to assault the officers, and they've deployed their taser. When a taser's deployed, it releases these barbs, and they'll then go into the skin, and then they create a circuit to conduct the electricity through the body. Other units are already there, but Nathan's going to hopefully remove the barb, and then the patient will hopefully then be conveyed to custody.
Police tasers in the UK deliver up to 50,000 volts of electricity in rapid pulses over 5 seconds, designed to stop and stun dangerous and violent suspects.
Yeah, not bad, thank you.
A police patrol unit and an ambulance are on scene.
Just go take the barbs out. Yeah.
But Nathan is the only qualified paramedic to remove the taser barb or fishhook type dart.
Whereabouts are they? Just obviously there and then... Oh, a second. Sorry, I'm Nathan, by the way. I should introduce myself first.
The man is also wearing what's known as a spit hood, a breathable mesh hood to stop the police from being spat at or assaulted.
Sorry, it's going to hurt a little bit.
And under arrest, he now seems calmer.
Sorry, mate. No, that's stuck in. It's going to have to go just to have a little cut to get out. No, it's proper wedged. Okay, that's it. It's hurting him too much to pull it. Back of the van.
The suspect will have to go to hospital to get the barb removed.
You guys able to convey to them?
Yeah, can do if that's
excellent.
What you're happy with.
And JRU Special Sergeant John will accompany him in the ambulance.
Anyone who goes to hospital is technically a prisoner guard, so it will always be 2 officers regardless of kind of what they've done or what's happened.
Good 2 minutes, mate. They'll hand over, then you get seen by a doctor. All right? And then you know the score after that, don't you?
At all times, he will have the 2 police officers by his side.
So when suspects go into custody, they are asked a series of kind of medical questions to make sure that they're fit and healthy to be in custody. So, yeah, he has to be medically cleared by the hospital, and then he can be taken back.
And on arrival, it's important the suspect's checked before being released, because he could be held for up to 24 hours in the custody suite while police wait to press charges. Paramedic Aisha has called an ambulance crew to help move a driver with a potential spinal injury after a car crashed into the back of him. while Tom gets the breathalyzer results of the driver who was in the car behind.
The test has come back that you've blown 55. Okay, the legal limit is 35. So at the moment it is 14:33. So you're going to be placed under arrest, failing a roadside breath test. Okay, you do not have to say anything, but it may harm your defence if you do not mention when questioned something you later on in court. Anything you do say may be given in evidence. The reason that you're going to have to be arrested is to secure and preserve evidence.
While they wait for the ambulance crew to arrive, Aisha prepares to give Nigel Entonox,
Right.
a mixture of oxygen and nitrous oxide.
It works very quickly, it also wears off very quickly. So if you find that you're not liking how it feels, you can just stop inhaling it and it will wear off.
After checking he's okay to be moved around, Aisha also examines any other symptoms of physical trauma
And whilst that blood pressure's going, just keep it as relaxed as you can.
and bruising from wearing a seatbelt.
I'm just going to feel across your chest, all right? Does that hurt to press?
Yeah.
Okay, all right.
It's quite a good demonstration, really, that the two of us being in one car. So we've got patients being treated medically, and then we've got a drink driver that I was able to sort of interject quite early on. Take a step to the left for me, please. Thank you.
While Tom has dealt with his driver, Aisha has a problem with hers.
Is that helping your pain?
A little.
Yeah.
The gas and air she's given him isn't taking the edge off his pain.
So we're going to try and get something a bit better going.
Time for something stronger.
So this is morphine, very good for severe pain, and this gentleman's saying that he's got 9.5 out of 10 pain. It's all right, sharp scratch, my love. Amazing. Right, so in a moment, with our assistance, we're going to try and get you out as carefully as possible, all right? If I go behind him to help him try and get out as straight as possible, and you guys try and get him out from the front, yeah? So, we're going to, whilst trying to keep you back as in line as possible, try and just move your hips a bit straighter. Yeah.
Aisha and her colleagues must keep Nigel's head, neck and spine completely aligned to prevent any further damage to his back.
Three, you just slowly stand up, all right?
Yep.
Ready? 1, 2, 3.
Well done. Amazing. Well done, Nigel.
You want to turn with me?
Well done, Nigel. Right. Now bum straight down. Okay. Just take as much of that gas and air as you need, Nigel. Is that really painful?
It is when you push it.
It's not hurting to breathe though, no?
It's off to hospital, where the doctors will do a CT scan on Nigel's back to find out the true extent of his injuries.
Yeah, I think perfect JRU job. Lots for me to do, lots for the police officer to do. This is exactly what we're here for.
Can anyone respond to a C1 emergency?
That's a C1 for a paediatric fitting at Rochester.
Every month in Kent, more than 4,999 calls are categorised as C1, meaning a patient has life-threatening injuries or a time-critical illness. 8:30 p.m. and Special Sergeant John and Paramedic Chelsea are heading to a Category 1 call for an 18-month-old baby having a seizure.
With fitting, our biggest worry is going to be kind of their airway. All the time they're fitting, they've not really got a patent airway going on. They're not getting the oxygen they necessarily need, and in turn their brain's not getting the oxygen that it needs.
In a Category 1 call, the JRU need to respond within 7 minutes.
We're 2 minutes away.
They get to the location just minutes after the call.
Let's go.
Hello, you right? Okay. Who's upstairs with him? Okay.
Hello. Hello. Oh, hello, little one.
The baby is no longer fitting, but Chelsea needs to check he's out of danger.
And what's happened?
He threw up about 30-45 minutes ago. And then we brought him up to wash him, and then he started shaking quite a lot.
Whole body?
Yes. So initially I thought, oh, it might be because he's cold, but then he went into the bath, and the bath was obviously quite warm.
Okay.
And then he continued afterwards.
Have you been checking his temperature throughout the day? Has he had a fever at all?
We haven't done a formal test, but he has been quite warm to the touch, but we've been treating it with Callout.
The family have given the baby a children's liquid-based paracetamol designed to relieve pain and fevers. But now, Chelsea needs to see if it's taking effect.
Hey, little one. Can you open your eyes for me? Oh. Okay, it's going in your ear, little one. Hello. Who's all these strange people? I know, I'm sorry. I'm sorry. 39.2. Let's get all this off of him.
39.2 is very high. A baby of 18 months would be expected to have a temperature of 36.4, nearly 3 degrees lower.
It sounds like he's potentially had a little, febrile seizure because of his temperature being so high.
A febrile seizure is a fit caused by a fever and can be common in small children. They're usually harmless, but Dad tells Chelsea about a worrying complication.
I think the only time he had sepsis in it when he was little, he had to spend a week in hospital.
Because he had sepsis?
Yeah.
What was the sepsis from? Do you know? Where was the infection?
So he had, the breast tissue was swollen when he was born.
Okay.
Sepsis is the body's extreme response to an infection and can cause organ failure and death. But even if it's treated, it can leave the patient feeling unwell for months, even years afterwards.
Okay.
So Chelsea takes no chances.
I'm going to recommend a little trip up to the hospital to be checked out tonight, just because obviously he's had potentially a little seizure and he's never had one before, and his temperature is quite high. So just to be checked out by a doctor.
Yeah.
Just 8 minutes later, an ambulance crew arrive.
Oh, hi.
Oh, hello, how are you?
We're just going to head down.
How are we? Should we head down?
Yeah, we can go straight out to the truck.
Oh,
I think he's had a little febrile. Yeah, he's had ibuprofen inside the ambulance, as well as he had paracetamol indoors. They both work together quite well to bring down temperatures. He's a lot more alert than when he was indoors. So just be a little trip to hospital and get seen by a doctor.
How are you feeling, sir?
Stop!
What's happened, mate?
I've leant on it and it just came out.
Okay, all right, darling, all right.